morning, Chairman.
Good morning, Joe. Hope you are well. Good morning, everyone, and welcome to this meeting of the Adult Care and Public Health Scrutiny Committee. I am Councillor Jimmy Brooks, the Chair of the committee, and sitting to my right is Vice Chair Maggie Cullen. In addition to welcoming all members to the committee, I would also like to welcome Councillor Steve Clegg, Executive Counsel for Adult Care and Health, and Martin Parker, Assistant Director to Public Protection. Before we begin, there are the standard announcements. If we have a fire alarm, please leave by the rear doors into the reception and out into the car park and wait further instructions. The audio-visual feed of this formal public meeting is broadcast live via the county's website, and all your comments will remain accessible online. Please have all mobiles, laptops and tablets on silent mode. The hearing loop is now activated. Requests to speak will be collated by the top table by Councillor Cullen. Please indicate early if you wish to speak. We will now move on to the formal agenda. Joseph, do we have any apologies?
Yes, Chair. We've received apologies from Councillor Lee and Councillor Locke. The Executive Support Councillor for Adult Care and Health has also given his apologies. Thank you.
Thank you. Agenda item 2. Declarations of members' interest. Do we have any members wishing to declare an interest? No. Thank you very much. Agenda item 3. Minutes of the meeting of Adult Care and Public Health Scrutiny Committee held on the 25th of March. This item is to approve and sign the minutes of the last meeting as a correct record. Please turn to pages 5 to 12 of the agenda pack. Do I have any questions? No. Do I have a proposer? Thank you, Councillor Reeve. Do I have a seconder at all? Councillor Cullen. Could I have a show of hands in favour, please? I think that's unanimous. Thank you very much. That's carried. Agenda item 4. Announcements by the Chairman, Executive Councillors and Lead Officers. I do have announcements. I have a couple of announcements. Is going to be a mini workshop to follow the public meeting today. The committee is due to receive a report from the Lincolnshire Safeguarding Adults Board that presents the annual position and communication updates to members of the committee for 25-26 in due course. Following today's public meeting, members are asked to attend a short informal session that will allow us an introduction of the works by the LSAB and raise awareness of themes to be reported in the next internation of the annual report. Members are invited to note that due to changes that emerged from the recalibration of the committee following the May 25, the report for 24-25 has been circulated internally for information and is already published via the LSAB website. I would also like to take this opportunity to thank Maggie Cullen, Vice Chair, for her participation in representing the committee at last executive meeting held on 8th of April. And to further relay the position, comments and expression of gratitude for the committee's work and the ethos expressed by the chairman of the executive and leader of the council, Councillor Matthews. We have a lighter agenda today. However, I would like to ask the officers, when presenting reports, to take these as read and to offer a short summary of key messages to allow us to focus on asking quality questions. I also have an announcement. The Principal Social Worker Annual Report is the first of its kind produced by Lincolnshire County Council, making an important step forward in how we assure and improve social work practice across adult care. This, alongside the first adult social care strategy for Lincolnshire, demonstrates how we are making a positive difference for residents. Moving on, are there any announcements for Councillor Steve Clegg?
Thank you, Chairman. No announcements.
Thank you, Councillor Clegg. Martin, do we have any announcements?
Yeah, thank you, Chair. Just one from me. Just wanted to update the committee members where we were in terms of our CQC reports and when we're likely to see them come to this committee. Looking at the timelines that we have been in liaison with the CQC, and also recognising that we're currently going through some local elections, we are not likely to receive, or the report is not likely to be published until early June. Probably that first week in June is when we're being told is likely the public publication of that. We will obviously see that prior to that, but it's obviously strictly confidential in terms of our receipt of that and our comments between ourselves and CQC prior to the public publication of it. So it is likely that it won't come to this scrutiny until the 29th of July scrutiny committee, but it's likely to have been published by that scrutiny time. We may wish to consider an extraordinary meeting, Chair, in terms of wanting to do an item on it at the point of its publication, but that's something I think for us to consider at a later date. But at the moment, it looks like we were likely to schedule it for the 29th of July.
Thank you, Martin. Do we have any members? Sorry. Yeah, just come into that, Councillor Overton. Have got any members wishing to ask questions relevant to Martin's statement, nothing relevant to the agenda? Thank you, Councillor
Thank you very much. Yes, I don't think that's acceptable. I think it should be published. I think hiding something because of a local election is not correct. The work of a council is expected to continue through an election period. The only thing you're not allowed to do is to highlight a councillor or agent who's involved in the process. But to stop council work because of a local election is not acceptable. I don't think that's legally correct. So I would like to suggest that we go back or run it ourselves in private if we must, but I don't think it's not acceptable, it's not correct. There's no legislation that allows for withholding work. The problem with delay, for me, means that, you know, if there are things that need resolving and we need to do our job in encouraging them to be resolved, that's our job. We try to make sure that everything's been done as best as we possibly can. It prevents us doing our job until late. And who knows what can happen in the meantime. You know, delaying our work for no good reason is not acceptable. Thank you.
Thank you, Councillor Overton. Martin, would you like to come back?
Yeah, obviously that's not a decision for me, that's a decision for the CQC in terms of that, but I will feed that back in terms of saying that actually their delaying of the publication of them due to PERDA, due to local elections, is something for them to pick up and consider. We're not the only council that is potentially having their publication of CQC reports delayed. But again, I'm quite happy to take those comments back to CQC in the discussions that we have with them.
Thank you. I think the question is under what legal position, because I don't see one at all. Thank you.
Thank you, Councillor Overton. Any other questions? Councillor Bean.
Thank you, Chair. Just to clarify, so it's the CQC that are delaying the publication, not the Council?
Yes, not the council. It's the decision of the CQC to when they publish the reports.
Thank you.
Thank you for the questions. We'll move. Yes, Councillor.
Sorry, Chairman, one thing. I mean, even accounting for that, and, you know, and notwithstanding what I've just said, but if they do give it to the council to work on, then is there anything to stop us having a private meeting so that at least we can do our job, even if it's not in public? Thank you.
Okay. Martin, anything?
Yeah, I'll pick that up. And
thank you very much. Thank you, Councillor Overton. Thank you, Councillor Bean. We'll move on to the next item now. Agenda item 5, short breaks and recommissioning plan. This pre-decision scrutiny report can be found on pages 13 to 48 of the agenda pack. The committee is invited to consider the report and to acknowledge the report's recommendations to the Executive Councillor for Adult Care and Health ahead of his decision on the 5th to the 13th of May. This year, the views of the committee will be reported to the Executive Councillor following today's meeting, and part of that will be of his consideration on the item. The report will be presented by Martin Parker, Assistant Director of Public Protection, and further presented by Anne Doyle, Interim Commissioner for Commercial Services, and we also have Carl Miller in attendance, and he'll be answering any questions, and he's a Senior Strategic Commercial and Procurement Management. Martin, over to you.
Yeah, we perhaps need to shorten down some people's titles, I think, just to kind of give some help to us. The first thing, members of the committee, I'd just like to point out is there's a slight kind of contradiction within the paper in terms of the recommendation that you're being asked to consider is around allowing the Exec Director of Adult Social Care and Public Health to make a decision based on your comments. Within the EIA on page 35, it talks about it going to the executive and that executive meeting being on the 5th of May. That's not accurate. It is as per the recommendation on the part bit that it's consideration of the decision for the exec councillor to make. I just wanted to kind of make that clear before we started in case anybody had picked that up. So in relation to short breaks, so short breaks is an emergency respite does play a critical role in enabling adults with complex needs to live fulfilling lives within their communities. And this is while sustaining the health, well-being and resilience of unpaid carers. For many people and families, access to timely, appropriate short breaks can prevent crisis, reduce escalation of need and support caring relationships to continue safely over time. Currently in Lincolnshire, we have an existing building-based short breaks model which has provided essential support. However, feedback and service review evidence indicates that it can be limited in flexibility, choice and also responsiveness. Its fixed nature can make it difficult to personalise support, accommodate changing needs or ensure equitable access across the county. And for some individuals, the experience can feel institutional rather than centred around everyday life. We've talked a lot at recent committees around the adult social care strategy. The proposed recommissioning of this service shows a deliberate shift to focusing on which places people have, where the relationships and the independence that they have within its core in terms of the choice that they have. Our strategy ambition is for care to be strength-based, preventative and short breaks provided locally to home, to local communities, with a community focus underpins this move that we're presenting here today. The approach is intended to create a more flexible, locally based and person-centred offer, making use of settings that already have skilled workforces, appropriate facilities and the ability to respond to a broader range of physical and health-related needs. The short breaks recommissioning proposals kind of forms part of an ecosystem around supporting the short break elements within day opportunities, within voluntary groups. This is part of a kind of a locally based ecosystem of choice and when and how people who draw on care and support can have choice in terms of how they coordinate and operate their short breaks. For those people that do draw on care and support, this model offers the potential for short breaks to take place in settings closer to home, supporting continuity of that relationship and reducing disruption associated with travel. The use of those established residential and nursing homes can also provide reassurance where individuals have complex health needs, increasing frailty or fluctuating conditions, ensuring that care can be delivered safely and with confidence while remaining personalised. I will now pass over to Anne to take you through the work that she has done in terms of the recommissioning of short breaks.
Thanks, Martin. So, short breaks as a service. What do we all already know? We know any service delivered via adult social care is not free at the point of access. We're not the NHS. So, for everybody accessing a service, there will have been undertaken a financial assessment and the potential for an individual to contribute to the costs of their care. I think that's an important point to note, largely because over the past 2 to 3 years, there's been a number of engagement exercises with people who are accessing community-based services more broadly and family members and unpaid carers. Specifically to short breaks and emergency respite, what we can see is there has been recurring feedback from engagement, which describes absolutely how critical this service is, absolutely the significant and dire impact it would have if this service was withdrawn, but also alludes to and describes perhaps some of the current limitations of the existing model and the potential opportunities. Of course, considering the demographic nature of the county, considering our future of services, particularly pertaining to transition of young people into adulthood, who will also rely upon adult care services, it was only appropriate that we undertook a further period of engagement, which had a three-lens view. So that three-lens view focused on those young people and their families who will transition into adult services, existing people who access the service as current and their families, and fortuitously and really importantly, we have a named social worker approach across complex. What that means is our practitioners, our social workers, are enabled to establish one-to-one relationships with individuals who have a primary support reason linked to complex learning disability. So, three-way approach in terms of targeted and focused engagement. And as you would all expect, that engagement was the outputs of that engagement was utilised alongside considering an evidence-based approach on the current utilisation, current configuration of the existing provision, recognising the existing provision delivered by a provider making space has served the county well and has been a successful delivery model over a number of years. So the model is current, as Martin's already alluded to, 2 buildings owned by the council, leased to Making Space the provider. And of course that's against the backdrop of evidence of increasing complexity of need, and if you focus solely on the 2 buildings that are utilised, ongoing dilapidation, ongoing requirements around maintenance, and when you combine that with the consideration of increasing complexity and need and the requirement for clinical intervention, our existing model of delivery starts to present some limitations. Of course, from an adult social care act perspective, 2 key duties come to the fore here. The first one of those duties, of course, being in relation to undertaking assessments and responding to individuals who have eligibly assessed needs. We also have a duty pertaining to market shaping, market sustainability, ensuring our care market is buoyant, is diverse and continues to innovate. In an attempt to redesign and propose a redesign of planned short breaks and emergency respite, I've looked at both of those areas of duty. Of course, we'll never get to a position where one size is 100% fit and match for everybody, which is why it's also equally important to draw out during the analysis phase of considering the recommission. I also looked at some of the existing arrangements that have been in place for over 3 years, which operate outside of the contracted arrangement that we're talking about today, those building-based provisions. In looking at the alternatives which are currently in place and have been for over 3 years, that's for a quarter of people who utilise short breaks or emergency respite. What that did is create a platform to enable consideration of, actually, could we extend that model? Could we extend what already exists in a localised, community-based approach and build upon that in terms of delivering a diverse and future-proof model for short breaks and emergency respite? hence the proposal as stands today.
Thank you very much. Carl, do you need to add anything?
I won't, no. Thank you, Chair.
Okay, thank you. Thank you for that. Now invite members to ask any questions. Councillor Reeve.
Thank you. With a lot of local authority funded elderly patients that end up in a care facility, some nursing homes actually lose money on the locally authority funded people. So I'm just a little bit concerned that are there enough people willing to provide the spaces that we're looking to attain in lieu of the Swallow Lodge and Cedar House around the county? I think it's a great idea, especially because it keeps things more local, but I just worry that there's going to be enough people come forward, and you've probably not been allowed to start negotiations yet because of certain constraints, I don't know, but do we know if there are enough people or not? Thank you.
Thank you, Councillor Reeve. And to answer that question, yes. So in September of last year, in the analysis phase, one of the things I did was undertake direct pre-market engagement with the sector you describe, particularly pertaining to those residential and nursing providers who deliver specialist provision for working age adults. Because it was really important to test the appetite. If the appetite, as you rightly described, didn't exist, then this is an expanding model which becomes our preferred contracting route, was a non-starter from the outset. Absolutely positively in September, what happened at that pre-market engagement event was collaboration across those residential and nursing providers, discussion of how this model could be executed, what were the potential frailties attached to that, but equally how could we solution those before we take this further. Really positive engagement, really positive feedback, and the market absolutely welcomed the opportunity to diversify.
Excellent, thank you.
Thank you. Councillor Cook.
Thank you, Mr. Chairman. I've got a few quality questions today. Thank you. So I've obviously read the report. Thank you, and thank you for your update as well. And I think the report is clear that the short breaks are highly valued, and that any change creates anxiety for families, particularly where people have used the same service for a long time. So I suppose really for me, it's what will the transition plan look like in practice? I guess who's going to be accountable for it? And will every existing service user have an individual sort of transition plan before the current arrangements end on the 31st of August? That's my first question. Thank you.
Thank you, Councillor Cook. I guess firstly to say, really pleased to note that you teased out the areas you did, because absolutely critical to anything we do in terms of change has to be putting the individual, the cared for person and their family at the centre. And if we can't execute an appropriate, well-planned and organised transition, then we're failing, is my view. So from that perspective, whilst recognising we're at proposal stage and no decision has been made, absolutely transition planning is in discussion within the council. Ensuring our social work teams are absolutely on the front foot and really exploiting the opportunity that we've got a named worker approach where long-standing relationships have already been established. So absolutely critical that plan is there. And from an individual and a family perspective, what I'd want to describe is, of course we aren't in a tendering and procurement process yet, but what we will ensure is factored into that is the ability for individuals and families to touch and feel what this new service will look like, what their experience of it will be, and of course, significantly will be the element of choice. There'll be multiple providers, and people will want to ensure there's confidence, but equally important is we'll move to a model, should this decision be taken, where there's strong coordination in relation to a booking system, that families as current coordinate that booking arrangement themselves directly with the provider, which also will give us front-hand real-time oversight of any teething problems, because of course we'd want to resolve those and mitigate them as soon as.
Just a quick comeback on the answer. So in terms of the transition plan that you mentioned, obviously it's still being worked through, and I don't know if this is a question more for our officers or not, is I suppose who's then going to sign off and agree that transition plan so we're content that it fulfills the requirements that we set out? I don't know if there's an answer to that one. In terms of where that transition plan is going to be approved, is that coming back to scrutiny, or is that being delegated to officers, or...?
Delegated to officers as opposed to coming back to scrutiny.
Okay, thank you. And then in terms of my sort of second question, and from my reading, so the proposed model obviously depends on securing the up to 12 beds across up to 12 providers and 3 geographical lots as such. Forgive me if I'm wrong, you can correct me on that one. And I suppose, what assurance do we have that the market can provide the right capacity in the right places, including rural areas? And I guess, what is the fallback position if one or more lots does not attract the sufficient sort of quality providers we are seeking to find?
So, building upon the pre-market engagement that took place, that was the first stage in September. That's been followed through with more detailed pre-engagement with the market. That detailed pre-engagement was predicated on a significant amount of geographical and demographic analysis. Of course, considering the spread of specialist provision for working age adults across the county, assessing also their capacity in terms of availability in space to deliver this new ask and a new provision, and considering with detailed analysis the existing people who utilise the service and where they currently live, as well as considering the transition arrangements over the next 3 years where young people will transition into adulthood. So all of that resulted in considering the existing locality splits across the county and the potential of consideration, really from my perspective, is that we have an over level of interest as opposed to an under level of interest across the county. Hence the evaluation process in relation to the procurement exercise needing to be sufficiently robust to address that. Obviously, those specialist providers across the residential nursing market undertaking service delivery and support for working age adults are already well established and regulated by CQC in their field of their expertise. There's limited concern and limited lack of confidence that there'll be an undersupply. I think the reverse is probably true. But should there be a need for a fallback plan, that fallback plan really lies in what currently exists. So we have a shared lives provision who also deliver short breaks and emergency respite. And fortuitously, our emergency respite utilisation is really, really minimal. And that's testament to the excellent job families and unpaid carers undertake, as well as the strong proactive management linked to named worker approaches across this particular set of individuals who utilise these services. So I would say risk is very, very limited, but of course it should be a watching brief in the procurement exercise.
Thank you, Chairman, and thank you for indulging me. So my final point then is obviously, we've talked about we're moving from 2 dedicated buildings to multiple residential and nursing settings, which can obviously improve the choice and flexibility. I don't deny that. It does create a more dispersed model. And I guess, how will we as a council and perhaps this committee ensure that consistent quality, safeguarding, staff training, CQC rated provision across all the providers, I guess what performance indicator will eventually come back to this committee. And I think in terms of the transition plan, I think I'm probably not concerned. I think I would probably appreciate that being seen by this committee, so it gives us the assurance, because that's the element of risk really around the transition. And if we aren't seeing that, then obviously all we will then see is at the end where, let's hope there isn't a failure, but actually it'd be quite good to have a heads up on that transition plan, because ultimately as Scrutiny we should be looking at it holistically. And I don't want to get into the weeds of, you know, officer decisions, but I just think an overview would be quite helpful in that perspective. But yeah, I think going back to my question in terms of how, you know, what performance indicators are going to come back to this committee and how can we measure success, I guess.
I guess the first response I would provide in relation to that is, in terms of quality, in terms of safeguarding, in terms of delivery of the service, of course all of these providers are regulated, and part of the evaluation of the tendering process will consider significantly the quality and safety dimensions in relation to this provision. Fortuitously, we have a robust and mature contract management function who undertake both strategic and operational contract management and work with this provider market currently, because of course we're utilising and will intend to work alongside the current provider market who deliver care for us already, so known, tried and tested. In terms of performance measures, absolutely. Performance measures are being developed in relation to the contract, should this proposal become a decision, and those performance measures from a quantitative and qualitative safety perspective will be robustly managed through our contract management function.
Thank you, Councillor Cook. Thank you, Anne. Councillor Bean.
Thank you, Chair, and thank you for the report. I did have some questions for you. However, Councillor Cook has already covered them, so I'll withdraw my request to ask a question.
No worries. Thank you very much. Councillor Reeve.
Thank you. It's probably not a question for this committee, but it'd be interesting to know that if this goes ahead, if the old building, Swallow Lodge and Cedar House, will be sold on to recoup some of the cost to the council, or if there's any other plans for those facilities. Thank you.
Yeah, you're right. We'll take a corporate view on what's the best use for those buildings in the future.
Thank you very much. Councillor Woolley.
Thank you, Chairman. So, surprise, surprise, I've got a number of questions. I'm going to dot about a bit. Unsurprisingly, the response level was low regarding the feedback from the families at 23%. Why? And before you answer, quite frankly, why would families, this whole area about asking people for their views is particularly sensitive, because families on the whole, if they have a loved one that needs respite care, they're hardly going to turn around and say, no, it's a rubbish facility, or it's not good and I don't want to put my family member there. So not only is the response going to be low, it's going to probably be less than accurate. I'd like to know what reassurance you can give me that what responses came back were anonymised and indeed were accurate. So that's my first one. Do you want me to pause? Yeah.
Is that one for Anne, is it? Thank you.
Thank you, Councillor Woolley. So firstly, reference in the report, as you rightly tease out, around the unsurprising limited response. Where does that reference come from? Reference comes from a number of places. Firstly, in terms of engagement, in terms of evaluation, in terms of completion of surveys, statistically, from a national perspective, borne out in regional approaches also, a statistically valid response rate to the undertaking of survey and evaluation generally tends to lie between an average range of 21 to 26%. That's why that reference was made. That's further borne out by the biannual completion of the statutory survey undertaken by the NHS Information Centre. Biannual, which is aimed towards carers, and the rotation is of the other year is individuals in receipt of service. Again, from a Lincolnshire perspective, the response rate mirrors the response rate in relation to this particular targeted exercise. In terms of the execution and to provide assurance on the approach taken in terms of undertaking engagement and seeking feedback, I ensured the approach that was undertaken was supported and considered by our corporate engagement team, was considered in relation to our named social workers in terms of the appropriateness around engaging and utilising this as a methodology in order to receive responses. Fortuitously, our named social worker approach also supported the exercise of engagement. And that same approach was taken in relation to young people and transition cases, so people who will move into adulthood. In terms of were the responses anonymised? What I can say is we utilise the digital platforms available across the council to enable people to respond, which meant their individual personal details were not shared. So all responses in whatever form were considered, and where necessary and where appropriate to do so, if an individual or a family member asked for follow-up or individual support to enable their voice and view to be heard, that was also followed through.
So that percentage, how many actual people and families was that?
Oh, I can tell you that exactly. So 131 people directly were engaged. That split.
Before you go on, out of how many who could have been engaged?
So 131 were the totality of those engaged.
Yes, I'm asking out of those, out of the whole service, because if that's only 23%, and yeah, my maths isn't brilliant, but that...
response rate was 30.
30 people.
Yes.
Thank you.
I hope that answers that part of the question.
Certainly does, yeah. Do you want to go on, or shall I, Chairman? Did you finish what you were
yes,
asking?
thank you.
Yeah.
Thank you. Okay, thanks for jumping in there. So the bit that I'm extremely concerned about is this business of the for what period of time only you will be able to tell me. Those buildings have only been at around 50% to 65% capacity. And yet, if I've read the information correctly, the subcontractor, for want of a better term, Making Space, has received, or there has been additional spend, let's say, because I don't know if it's gone to them or elsewhere, there's been additional spend on top of that contract for services that are not even being taken up by those that could do. So over and above the original contract price, what amount of money has actually been spent on this service overall? Within the contract period, sorry.
So if I describe this from an annual perspective, the underutilisation that you absolutely rightly tease out as detailed in the report is largely due to a number of limited factors. One of those associated with the building configuration and ongoing dilapidation, so repair requirements. The two buildings that were earmarked for utilisation, council-owned buildings, were never purposely designed for the delivery of planned short breaks. And what I'd add to that is, in terms of increasing complexity of need, in terms of requirements around appropriate clinical intervention, the existing service delivered by Making Space in the buildings which are utilised for that doesn't lend itself well to support those approaches. Taking the next part of the question in terms of the spend, absolutely. Within the report describes the contract value annually, and it describes an additional purchasing arrangement that has been ongoing for a 3-year period to the totality year on year of up to £150,000, which has delivered short breaks, planned short breaks, and lesser so emergency respite. As I've already alluded to, emergency respite fortuitously is significantly underutilised and a limited requirement across Lincolnshire for those people with care and support needs and their family, which is an absolute success. So from that perspective, alongside the contract value awarded to Making Space year on year, there's an additional 150,000 that's earmarked to support the delivery of planned short breaks where the existing contracted provider has been unable to respond to that individual need at that specific time. I hope that answers.
Thank you. I'm happy to continue, Chairman, or if you would like to offer somebody else
I don't think we've got any more questions at the moment, so you carry on, please,
right.
Councillor Woolley.
So, the bottom of the table on page 18, table at the bottom there, we've got figures for 25-26, but we've no figures for 26-27. Now, if this contract doesn't finish until August 26, what are the figures for the even if it's only as a percentage of between April and August? Because there's nothing even to say that the uplift, which may be to do with 26-27, but it doesn't actually say what it is or what it's connected to. So where's the 26-27 figures? And then, try that one first.
Thank you. So in terms of 26-27 financial year figures, recognising, of course, we are still very early in the financial year of 26-27. There's a continued exercise undertaken by our contract management function, monitoring provision and receiving from the provider Making Space calculation on utilisation and uptake. There is no reason to assume, having early sight of placements to date, that the uptake will be anything significantly different from the previous financial year. However, you are absolutely correct. Within the report, there isn't 26-27 information presented, as that information wasn't available to me to include that at that point.
Chairman, if I may just come back on that point, what happened to budgeting in the previous year for the 26-27 financial year then?
Apologies, Councillor Woolley. In terms of budgeting, there is a contract value, which is a block contract for this particular provision with Making Space, and based upon the 3 years of utilisation of purchasing outside of the contract, that value has come to the £150,000, which again is set year on year. So the budget position, with the exception of, as you've already alluded to rightly, the annual uplift has remained and remains static.
Thank you, Chairman. I think there's just one more. Did CQC inspect this service?
Yes, the services are both Cedar House, Swallow Lodge, both registered residential facilities are inspected by CQC, both currently rated good.
Thank you. They're currently rated, were they inspected in this particular inspection, the CQC that Martin referred to?
Oh, no. The CQC inspection that Martin referred to relates to the council's own. These buildings are owned by the council, but the services are operated by an independent provider, Making Space, working under contract to the council. Those services are assessed by the CQC as registered residential services.
So they are completely separate?
Indeed, yes.
Even though it's the service is part of the overall CQC inspection. I'm just trying to understand if, for an example then, if CQC inspected the buildings and said, or the service that's being provided out of those buildings is not good, that does not reflect on LCC's CQC inspection, if that were to be the case.
That's correct, yes.
Thank you very much. Councillor Reeve.
Thank you. Councillor Lewis seemed to have concerns that there's only about approximately 60% utilisation of the planned respite throughout the year, but I mentioned this at a previous meeting and was told that, well, that's throughout the year as an average. When you look at weekends and holiday periods, it tends to be oversubscribed, and there's no way to balance that out effectively throughout the year. And so I guess that's still going to be a similar sort of case with the new format, that at weekends and different periods it's going to be oversubscribed, and then on average throughout the year we'll perhaps have a similar sort of take-up for the facilities.
Councillor Ray, thank you. In the current arrangement, as you can imagine, 2 buildings, not designed solely for the purpose of their current utilisation and provision, an increasing complexity in terms of individuals accessing and utilising the service. Provision based on an 8 and 7 split across the 2 buildings. That what's tended to happen and create the pressure is, should a person with care and support needs have a period of a planned short break and the scale of their complexity and the support they require, meaning that some parts of the building become inaccessible to others, it reduces the capacity exactly as you're describing. So the potential in the analysis I've undertaken in relation to the new model starts to disperse that approach, because if you can imagine, we have a dedicated number of residential and nursing providers, specialists in design, dispersed across the county. So the concentration and limitation of providing weekend support becomes dispersed rather than singly pressured in 2 buildings. So actually the reverse should be true. it should optimise the opportunity, not reduce it. I would expect to see greater utilisation, not less.
That's great, thank you.
Thank you. Councillor Overton.
Thank you very much. So we're talking about closing 2 current respite care centres, one in Spalding and one in Lincoln. I'm not sure that is, and we're looking to instead just commission as and when, but have some beds ready. So we're paying 3/4 of the cost. We would be paying 3/4 of the cost for an empty bed. But if I look at the problems that were suggested, that were raised from the current situation, this doesn't appear to resolve any of those other than the lack of maintenance of the building, which is owned by the council. So it looks as if the council's not maintained it. That's meant that some of the beds are not available. That's meant that it looks like it has a low occupation rate. The staffing isn't complete. There's some issues on the staffing as mentioned. And then, surprisingly, it's not, you want to close it. If we really wanted to do a good job, you've got one in Lincoln, one in Spalding, which is not a bad spread across the county. But I am a bit worried about the staffing because you said that you've already spent or have the capacity to spend 150,000 in other places when necessary, any extras that come out. And then presumably that's going to continue because the 1.2 million is the same as is in the current situation. You've got 1.2 million spent now and propose to spend 1.2 million as well. So presumably that 125 extra or 125,000 extra is going to still be there. My real worry is if you've got a place set up for people with adult, people with learning difficulties or whatever they need difficulties, and you've got a place set up and you've got it staffed, that sounds to me like quite an efficient system, rather than having somebody appearing in another working home. I wonder if we've really got, how many homes have we got that is suitable for adult working people? Are there so many that we've got that they have places that they can let out to us? Are there a lot of other places that are, you said that they're set up to be taking these folk, and you just think there's no need to increase, because this reduces the overall capacity for the county. Obviously, if you're closing 12 beds here and just taking 12 beds that are already extant. So we are actually reducing the overall capacity in the county when we know there is an increasing need. So there are a lot of things that don't seem to quite add up here, and I don't know if you can help me out on some of those. So really the question is, we're reducing the number of spaces. How is that possible when we have an increasing need? Why have we not maintained the buildings? And if this this doesn't actually resolve the problems that seem to be there. Sorry, there's quite a lot in there, but it was quite a lot of different information that was coming in. I decided not to go to just ask the facts. I'll just ask the overall policy direction. Thank you.
So if I pick up the capacity question first, Councillor Overton. So as current, across our specialist residential and nursing provision, there is capacity available which is monitored on a regular basis. In relation to the particular individuals we're referring to, so where there's a primary support reason attached to learning disability who live with their families in their local communities, unlike cognitive decline and physical frailty, there's a very, what I would describe, stable cohort. It's a cohort of people who have established relationships, as I've described, with individual practitioners. So from a utilisation perspective, whilst absolutely what you describe is the case, we are reducing the capacity of provision by no longer commissioning, making space to deliver the 2 buildings of provision. What that is balanced by is it's balanced by and with that we recognise and already monitor the levels of capacity that exist across our wider residential nursing market in relation to working age adults. So whilst I recognise there is a potential level of concern that actually what's presented is we're reducing the dedicated building space capacity, significant capacity already exists that we recognise as an opportunity to diversify its use and to utilise. Hopefully that answers the first part.
I'll just pick up that while I'm here. Access, you say, there is capacity. I think the point about the capacity is it when people want it? You know, there are obviously going to peak demand times, which I think was a really good point made by a colleague. But also raised in the problems that you're trying to solve, or that were raised before, is that access is one of the things mentioned in there. And I know that is some of the things that was mentioned by residents in my area. That is something, is a problem for them. And so we're saying there's capacity, and yet I know that people have difficulty accessing the respite care when they need it. So I guess what we're saying is we don't care. Is that right?
Respectfully, Councillor Overton, I'd say the reverse is true. I would say that in relation to weekend utilisation, yes, it's been absolutely a recurring theme of frustration and an inability to always confidently source and secure. In terms of the new proposition and proposal going forward, which presents 12 placements available each weekend, as opposed to a more restrictive model as current. What that should do is, because the existing placement utilisation, as I've described, if a weekend provision at one of the existing buildings is utilised for the purpose of a person presenting significant complexity in need, requiring some elements of the existing building to cease to be accessible, that's where cancellations of planned weekend short breaks have occurred over the past 3 years. The going forward model ceases to address that by ensuring through a dispersed delivery model with purpose-built settings of residential nursing provision, that ceases to be an issue. Of course, there'll always be a supply and demand question to answer. If everybody wanted a particular weekend in a particular year, there may be challenges in relation to that. But the broad feedback from engagement that we're seeking to respond to here is a dispersed delivery model gives greater opportunity for greater utilisation and capacity at those peak periods that have been points of frustration. Okay.
The next issue is about the costs. You've mentioned that you suggest paying £121 a week. I think I read that, if I understood it correctly, and we're currently paying £262 a week plus extras. So I'm not sure how that works. I maybe haven't read everything correctly, but how does that work? How much are you expecting to pay? Am I right? I see 121 here, but there must be plus extras, because that doesn't seem to be enough.
So the costs for the proposed new service will be aligned to the existing residential and nursing care framework costs. There are economies for providers in delivery of the services in existing settings, because they have already funding sources for the delivery of services, including staffing and other operating overheads already sunk into the services they're delivering in that location. Whereas in the current model of dedicated settings, whereby only planned and emergency short breaks are delivered in those settings, all of the operating costs need to be covered by the contract payment received from the council. So it's in that way that it's viable and feasible to deliver a reduced cost for the services, fundamentally consistent with the nature and type of services that are delivered in the current dedicated settings, but as Anne's explained, in a distributing model within these existing residential and nursing homes.
So the cost is high currently because the occupation is low, and the occupation is low partly because we've not maintained the buildings. The other controlling force on the number of people in there is whether they get referred or whether they're able to access it. It depends if they're paying or not, I guess. Many of them are paying, I know, but not all of them. And that is something also that's within the council's control. So it might be that they're not necessarily being able to access as much as they could, or are they always, what are they allowed to do? Is it 1 week a year? And how many people is that available to? Thank you.
Just on the buildings maintenance point, I don't think it's accurate to say that the buildings have not been maintained, but they are of an age where there are issues have started to emerge that have needed to be addressed, and in addressing those, it has meant that the buildings have been either unavailable or needing to operate at reduced capacity for a period of time, which has consequently impacted the overall availability and occupancy of the buildings during the last 12-18 months.
I accept that, yeah.
I'm sorry, can you repeat the second part of that question, Councillor Overton?
I think we've probably got there,
Okay.
thank you. I've probably troubled you enough. Thank you.
Thank you.
Thank you very much. Councillor Litchfield?
Yeah, I think it's really been asked, but I guess from a demand perspective, is there a risk that, from a localised perspective, so if there is more demand in this area and then that facility is oversubscribed, it's more of an operational question. How does that then, how are those patients then, or where are those patients referred to? Are they referred to their local location, or would they, which would then be overcapacity and potentially additional costs, or would they be referred to another location to balance that demand across those locations out?
Thank you, Councillor Litchfield. I guess a couple of responses in terms of your question. So, firstly, significant amount of demand analysis has been undertaken in terms of profiling where across the county future placements would be required. That's also considering the current locations, permanent homes of those people with care and support needs utilising the service, and profiling the future incoming need linked to transition cases over the next 3 years who potentially could utilise the service. That has informed the profiling of numbers across the 3 locality splits across the county. That's the first thing I would say. Second thing I would say is actually what this does is it allows us to strengthen demonstrating linked to the Care Act choice and control. So for an individual and their family, should this proposal become a decision and we procure 8, 10 providers to deliver this service, an individual and their family will have choice as to which location they would want their planned short break to take place, because there could be a number of factors you'd want to consider. The first of those, absolutely postal code, home address, what's geographically best place for somebody, but also complexity of presenting need. So does the individual have particular clinical interventions that would be better supported by a nursing provider, or other considerations in relation to should an individual be receiving and accessing a planned short break and other substantive family members who provide the predominance of care are in a different geographical location during that period. This model potentially offers opportunities to be flexible about where an individual utilises and accesses their period of support. Do I think there's a concern that there'll be greater demand and oversubscription in some particular placements as opposed to others? Demand modelling suggests no. However, there are particular levers that will be inserted within the contract that gives us flexibility to further diversify the model or make adjustments as we need to, so ensuring that people receive the right level of support in geographical areas that are best placed for them.
Thank you very much. Councillor Woolley, is it a quick one? Thank you.
Absolutely is a quick one, yes. Huge apologies, but I cannot for the life of me see where this proposed new contract date is meant to start. I can see where the old one is meant to end, but when's the date for the new system, whatever you want to call it, going to start? And what mitigations have you got in place if, for whatever reason, there's a delay?
Sorry. The new contracts are planned to commence on the 1st of September this year. Yes, the timescales are tight, but achievable. The recommissioning has been planned to align with the existing contract end date. Market engagement has already taken place, and the proposed model uses established providers, as we talked about this morning, rather than creating new services. So an 8-week mobilisation period following the conclusion of the tender process, subject to the approval of the recommendations today, have been built into the timetable, and contingency options are identified if any element is delayed. The focus is, of course, on managed transition, not a cliff edge change. Work to plan the transition, focusing on support to people who rely on the existing services throughout this process is underway and will continue on confirmation of support for the recommendations.
Thank you very much. I'd just like to thank officers for the reports and their answers. Do you have something else, Councillor Woolley? You look like you're thinking.
Yes. If that's the case, get that. But how come, as far as the booking system is concerned, how can people, how does one dovetail into the other? Because people won't know which places are available on the 1st of September. Is it just me being missing something?
Councillor Woolley, in terms of the approach and the transition planning that Carl's just referenced, there are significant multiple levels of activity needing to take place in order to seamlessly land, should this become a decision, seamlessly land this in a way that supports everybody who will utilise the new provision. Significant contingency planning is underway because what's very clear is in delivering this new service, all of the components need to be in place. Part of the early engagement with the market, which has been a recurring theme, has been seeking assurances of their mobilisation. The support mechanisms in terms of establishing a booking system are already advanced on the potential that this proposal could become a decision. And our practitioners who work with those families and individuals with care and support needs who will utilise the service going forward, that work will commence in earnest and is lined up to do so the minute a decision is taken. That isn't to say there won't be multiple strands of activity taking place at pace. What it is to say is all of those variables are being considered, recognising the limited time attached to this piece.
Thank you very much. Thank you, Councillor Woolley. Thank you for your questions and comments. That now concludes the discussion on this item. A summary of our comments, as captured by the Scrutiny Officer, will be shared with the Executive Councillor for his consideration. Chiara, do we have a summary?
Yes, thank you very much, Mr. Chairman. I'll just briefly summarise what was stated today and the key points raised by members, and what will follow up is a more in detail capturing of the debate today and the responses and assurances provided by officers. So on my list I have market capacity and provider appetite. So members have raised concerns about whether the market will deliver sufficient and sustainable capacity, and have sought assurances that provider interest will translate into deliverable provision across the county. In relation to capacity demand and local oversubscription that was highlighted, members urged of the risk of uneven demand across localities and potential oversubscription in certain areas, with a need for clarity on how demand will be managed operationally and balanced across the system. Implementation timescales were also highlighted in terms of delivery risks, and members have noted their concerns regarding tight implementation timelines and have requested assurances that contingency arrangements are credible and that transition will be managed safely rather than as a cliff edge change. In terms of quality, consistency and oversight, members have raised your concerns about maintaining consistent quality, safeguarding and staff standards across a dispersed model, and have requested clear performance measures and reporting back to Scrutiny. In terms of loss of dedicated facilities and overall capacity, members have questioned whether the closure of existing buildings would reduce overall capacity, and have sought clarity on how the new model will maintain or will enhance provision in the context of increasing demand. In terms of financial transparency and value for money, members have challenged the current and proposed financial model, including additional spend and missing data, and have requested a clearer assurance on value for money and financial assumptions. This summarises the key points that members have raised. There will be more in detail representation of the debate in the written comments. Thank you.
Thank you, Chiara. I move that the committee has considered the report to the Executive and that we acknowledge the recommendations to the Executive. Do I have a seconder? Councillor Reeve, thank you very much. Could I have a show of hands, all in favour, please? Anybody against? Any abstentions? Just two. Thank you very much. That is agreed. Agenda item 6, Principal Social Worker Annual Report. This scrutiny report can be found on pages 49 to 70 of the agenda pack. This report introduces the Principal Social Worker Annual Report attached appendix. Thank you very much, guys. Thank you. Attached. Where was I? Sorry, I do apologise. The committee is invited to endorse the report, acknowledge the progress of various elements reported in it, to consider key challenges identified in the report, and to establish whether we support the priorities set out for the year ahead. The report will be presented by Martin Parker and will further presented by Chris Erskine, Head of Professional Practice and Principal Social Worker, Community Care and Wellbeing. Thank you very much. Martin, over to you.
It's those titles again. Thanks, members. Yeah, this is, as the Chair said, this is the first time we've brought a Principal Social Worker report into Scrutiny, and we think it's actually really important to do so because Chris, let's put a name to the title and a face to the title. Chris is our Principal Social Worker, and we often refer to him as the kind of the heart and the soul of social work practice within all the things that we do and all the decisions that we make. And what he is doing is providing that professional leadership and assurance on the quality, the effectiveness, and also our continuous improvement of adult social care practice across the council. He plays a critical role in making sure that he's supporting the transparency, accountability and learning offered to you as elected members in terms of what we do around social care and social care activity. Again, this report is closely aligned to the ambitions that we set out in the adult care strategy for 26-27 and kind of sits to the heart of the principal social work practice elements in terms of placing people, relationships and independence at the heart of care and support. And our strategy is focused on that strength-based practice, the prevention and early intervention, co-production and workforce sustainability is all reflected through Chris's report here today, which he will go through in more detail. Again, the PSW annual report really does highlight, and Chris highlights in his own kind of working practices and working demeanour, he really emphasises that principal social work of it's all about what matters to the person, which hopefully he will be able to bring out to you today in terms of the work that he does and what that means to people of Lincolnshire.
Okay, thank you, Martin, for the introduction, and Chair, members, thank you for the opportunity to be here today and present my first annual Principal Social Worker report for adult care. I'm here today not just to describe what I've been doing as Principal Social Worker, but also it's really important to be able to share with you the difference that our social workers, our occupational therapists, our community care officers, our nurses, and wider colleagues make every day for the people of Lincolnshire. This report reflects a year of continued pressure and complexity, not without its challenges, but also clear progress. Now, there's a very deliberate focus on practice quality, learning, strength-based work and workforce development and co-production. That's a core part of what the Principal Social Worker does. Having worked with many of you previously, you probably know a little bit about the Principal Social Worker role and what it's here to do, but it's a statutory role. It's something that's required under the Care Act. In practice, that means that professional leadership, being visible, setting the conditions within adult care for excellent practice, quality assuring what we do, and ensuring that we keep on improving our practice as well. And doing all of that while staying grounded in the as Martin had said, the lived experience of the people who we work with in local communities and what they tell us matters to them. And crucially, my role really connects the frontline reality with strategic leadership. So being able to have that direct contact with Martin Parker, Martin Samuels, Haley Eccles, and so on to actually bring some of the frontline reality to the fore as well. So what that does is make sure that improvement isn't just a plan on a paper, on a page, but it's something that you can see the quality of people's practice, their experience, and also our ability to evidence what we do. So in terms of practice quality and continuous improvement, a core part of our approach is around quality practice assurance reviews, and that's a programme where we look as part of a learning cycle, which is the Plan, Do, Study, Act, and it really drives practical changes that matter to people. So that's around things like making sure we've got really good records, strong safeguarding, better mental capacity practice, and generally more consistent quality across all teams. So by the end of Q3 this year, we completed in the region of 450 quality practice assurance reviews, and we look at those standards and where we see opportunities to work individually with practitioners or with teams, or we see themes, we intervene and we look for improvements in that as we move on into the next period of time. A key thing that we do in those instances where we see patterns is to undertake thematic reviews as well. So that could be around mental capacity, it could be around direct payments, and then those findings we turn into targeted learning with people and actually reflective supervision, so working really closely with them. If standards aren't met, immediate feedback is made with the practitioner, follow-up learning, and we will see improvement in the subsequent reviews with those people. If I move on, in terms of the difference we've made, so just a little bit about why social work and occupational therapists matter. I really want to bring this to example with a few examples, if you'll indulge me, because the difference our workforce makes is often most visible in the moments that matter the most to families. One example that came to me, and I counted the examples of good quality practice that have come personally to me over the last sort of 5 months, and there were 33 explicit examples shared with me where members of the family or other professionals had got in touch with us. That's only a small proportion because some of the compliments and things like that won't directly come to me, but one of them, it might seem in sort of a fairly small thing, but there was support to somebody who's a carer. The person that they were caring for was at their end of their life, and some really practical and problem solving from the practitioner supported that person. So they identified that the carer who was supporting his wife at the end of life, he couldn't leave her, but she needed essential medication collecting. The person didn't know where to go to, so contacted the social worker, and the social worker contacted partner agencies, coordinated, and they found somebody local just to collect and deliver that prescription. It might seem like a small act, but what that meant was that the couple could spend their last days together with one less crisis. For me, that's social care at its best. The social worker didn't rush out and collect the medication, but they used the calm judgment and they worked with partners, people they knew in the local community, and showed some humanity under pressure as well. Another example where it really demonstrated strength-based practice translating into independence. We've been working on strength-based approaches for a number of years, and we will continue to do so. One of the ways of working more recently has been around our Better Lives approach, which is really about focusing on how we can support people to live the life that they want to lead. Now, this isn't theoretical, this is actually a real practical example of where a woman with learning disabilities was assessed through using the Better Lives tool and supported to move into her own home where there was assistive technology put in place. There was community connections established, which has supported her to achieve better outcomes and reduced isolation, but it also resulted in a less restrictive sort of approach to supporting her. Now, alongside that was a 40% reduction in care costs for her. So it was good for the person, and it means the resources we have can go further in local communities. So that's really what right support at the right time looks like to me. And it's a better outcome for the person as well, and a more sustainable use of public resources. But there are also many, many other examples of where there are distinct contributions from different professionals. We gather those and we celebrate them through things like nominations for people for social work, occupational therapy of the year awards. We celebrate that locally. I contact each of the people, the practitioners, to recognise the work that they've done, as does the assistant director and the director themselves. So we do recognise that, and we recognise as well from the feedback we have from practitioners how important that is for them to feel valued in their role, and it helps us with our retention as well. In terms of direct payment improvement was one of the areas we've highlighted. Now you may ask why that relates to the principal social worker role. If we work in a way that's strength-based, it means that we're supporting people to access support really only when it is needed, and that we're connecting people within the local communities. So one of the things that we've been doing with direct payments is to recognise that there are also a really practical expression of choice and control. It supports people to have more control over the way their care and support is delivered. So they may choose that to have, for example, short breaks. They may choose it to employ personal assistants or to do things that are really important and matter to them. So one of the things we did this year was to run a comprehensive direct payment improvement programme to look at whether our policy supported our ambitions, that we were effectively auditing direct payments, and that we were providing essentially the appropriate training and performance oversight. That work has supported us to change some of our practices and processes, and this year we've been able to demonstrate a significant amount of savings whilst also having relative stability in the number of people that are receiving a direct payment, which is one of the highest nationally. So the point I wanted to make to members is this isn't about cuts, it's about the right sizing of support, it's about us improving oversight, making sure that people get the support that's safe and aligned to independence. In terms of workforce development and grow our own and recognition, workforce remains one of our biggest determinants of quality. If we don't have the right people in the right places and working in the right environment, it's going to be very difficult for us to provide good quality support to people in the local community. We've continued to strengthen our grow our own approach through apprenticeships, through supporting newly qualified practitioners, practice educator pathways, leadership development. And we currently have 52 apprenticeships across adult care as well. So we've really invested in that. And we know the people that have been through those programs are more likely to stay with us as well. That plays out in the workforce data. In terms of a closing summary, so I can open up for questions, we've strengthened quality assurance over the last year, grown a more confident and reflective workforce. We've improved direct payments governance, still more to do. We've embedded strength-based practice through our Better Lives work and continued to build our readiness for assurance. But the most important point I wanted to make to all of you today is that this is not an abstract thing. It's about people we work with, often in highly complex circumstances, and frequently it's at the most difficult moments in someone's life. And I'm confident that we have a workforce that really values people's independence and really values supporting people to live the life that they want to live. So what I've shared to you today are not exceptions, they're just examples of what our workforce do every day. So thank you, and I'm happy to take questions.
Thank you for the report, Chris, and I look forward to more reports in the future and any updates you can give us. So thank you very much, I really appreciate that. I'll now open it up for members to ask any questions. Councillor Woolley.
Thank you, Chairman. And if I may start off with a comment rather than a question, because Martin and Chris can't possibly comment on what I'm going to say. And the clue's in the title. It's the report of the principal social worker. And Chris' opening line was to the exact point of welcome to my first report. I would ask the portfolio holder if he would consider that this is Chris's report and you open it up and the first two pages are the portfolio holder and the director of adults. And way down somewhere is Chris's mention. Chris is our principal social worker, and I think that more credit should be given to him in this document. He works blooming hard. I know he works very hard, so that's my comment. And
can
then,
I just get Councillor Lee come in?
Yep.
Thank you for that comment, Councillor Woolley.
Thank you, Chairman. Councillor Woolley, duly noted. Thank you.
Thank you.
Thank you. Second part most definitely is a question to the pair of you. Can you go to page, where are we, 69? And that bottom section, addressing CQC findings, new priority. So does the new priority come from findings that CQC have highlighted to you recently? Or where exactly have they come from? Because to suddenly pluck something out of the air seems a little bit odd without CQC offering the information or questioning you in the first place. Thank you.
Thank you, Councillor Woolley, and it's a good question. Just for context, it was in that particular part. It's not. I wasn't referencing CQC findings as such. What I was suggesting is it may be things like this that come up.
Right, I should choose your words slightly more carefully next time before it goes to print if I were you. Thank you.
Noted, Councillor Woolley, thank you.
Thank you very much. Councillor Reeve.
Thank you for your report. You mentioned quite a bit about staff retention and the grow your own attitude towards bringing people up and getting them doing exactly. I think that's a great way of doing things, really do. My question is, are you happy with the current levels of staff retention and staff with a job content and happiness? And is this something you can benchmark against other local authorities, and do you do so? Thank you.
Thank you, Councillor Reeve. I'm always very, very mindful of creating the right space for our practitioners to work and to be able to understand people's experiences. I speak to practitioners directly. We look at information from things like exit interviews. We look at the responses from the corporate survey, and we address the findings from those with our leadership team. One of the key things that has been introduced over the last 12 months is forums where Martin as DAS and the assistant directors will go speak directly to our practitioners and team members. So we absolutely do benchmark with other local authorities. We are not an outlier. Our workforce is reasonably stable. We do sometimes have challenges, and where there are challenges, we look at different initiatives to support recruitment and retention. But it's a really good question to ask, because it is something that I'm always highly focused on. We do have reporting as well that's looked at both local level and at DLT that tells us things like sickness absence, tells us how many people have left the directorate and how many people have been recruited and so on. I don't know, Martin, if you wanted to add to that.
Yeah, I think there's always more we can do, I think, is the answer. We can never stand still on staff recruitment, staff retention, because things change. You know, we get feedback from other authorities and other people that have kind of looked at our job adverts, you know, and there's very much a forethought now about people taking up job opportunities within social work practice about how well supported they are through digital. You know, so actually, you know, what is the council's digital offer in terms of terms of social work practice? We're slightly behind the curve on that, and that's causing us some kind of employment issues, because people are experiencing technology-supported enablement elsewhere in the country, so they're more likely to go there because it's more efficient, it's more effective. We've got, you know, be assured we've got these in our plans. This is things that we're looking at. So there's always more that we can do. The position that we're in now is a stable position. You know, we've got some great stories of people who have worked at Boston College, gone into the day opportunities provision on a work experience element. That person is now working full-time as an individual in the daycare centres at Boston, and is working towards becoming a social work practice individual within social care. There's lots of those stories that we've had because we've given people the opportunity. We have to do more targeted work in the likes of the universities and the colleges, because they all do Care Act type courses, social care courses, and we have to kind of thinking about when we target those people. So there's always more we can do, but we are satisfied with where we are at the moment and understanding where we need to take things through to make sure that we have got the social workers for now, but also for the future. Technology plays a big part of our recruitment process, and we're working on that quickly.
Thank you very much. Councillor Cullen.
Thank you very much. Excuse me. Thank you very much, Mr. Chair. Mine isn't a question, more a comment. firstly, thank you very, very much for the report, and please express my deepest thanks to your team, to yourself and your team. I have had experience of social workers through the palliative social workers, through them caring for my son, and I just want to take this opportunity to express my thanks, as well as inform the committee, and you probably already know, I have been in talks with Vicky Thompson from the charity Everyone, who has taken it upon herself to speak to LCC carers, the ICB Living with Cancer team, Connect to Support, and the Lincolnshire Cancer Co-Production Group. And I am very pleased to announce that very recently, just last week, she has informed me that there is now a dedicated page for young people who are living on the with a palliative cancer diagnosis on the Connect to Support website, which I am taking this opportunity to bring to wider people's attention, and I will be taking steps to let people know that this is now there, because when my son was on the palliative cancer pathway, there wasn't such a thing in place. So I am very, very pleased to say that through all their hard work, there's now somewhere that young people can go. So thank you very, very much.
Thank you, Councillor Cullen.
Thank you very much, Councillor Cullen. Councillor Young.
Yeah, thank you, Chris. I thought the report was really good. I thought it's easy to read. I've known you now for some years, and I think you're an excellent leader. I think we're very lucky to have you. I think you're well respected in terms of the staff force and workforce, and I think that says an awful lot. I've got a slight comment in terms of the areas for improvement. And I brought it really back down to basics, really, in terms of, and I don't know whether you would agree in terms of it needs to be in your annual report or whether it needs to feature somewhere else. But having been involved in terms of social care for years, I still struggle with the fact that customers, and I suppose most elected members will get the same sort of queries, is that when a customer or resident wants to access social care, they find it's extremely complex, as we know, and trying to navigate the way through that, and you highlighted in terms of most people want to access it when they're in crisis. I think there's a real need to kind of break that down in terms of actually a better understanding for customers in terms of what is social care and how people can access it and how it works, because it's very complex. I think in terms of some of our partners, in terms of NHS colleagues, etc., they have got no idea. GPs struggle with the whole thought. I know you do a lot of work in terms of actually going out and talking and networking with colleagues, but I still think it's a real issue, and I don't know where it needs to feature. But that was a plea from me in terms of actually, if we could do some more work around that, because I think it's a real issue. I think it's a national issue. I don't think it's just a local issue. I welcome your thoughts around that.
I'll start, Councillor, if that's okay, because some of this falls under my portfolio, what you've just described with, Chris supporting really in the background, and I think you make a valid point. So whilst been at this council since 2023, only really came into the adult social care element of it in sort of January this year, when Martin Samuels asked me to look at some of the work in terms of the restructuring of his of the teams into what we have now as the area-based teams, and then as a result and a consequence of that, he's asked me to take on more and more. So kind of wish what you kind of wish for is where you end up going ultimately. But I have exactly the same observations as you. So not previously kind of having a lengthy experience in adult social care, and also having tried to find care previously in my own circumstances around obesity and things like that. I really struggle to understand where I can get help and support, and what was the clear messaging, and what was that adult social care, was that something else, was that health. So you're absolutely right. So we are doing a huge piece of work about what we're describing about pre-front door. So what is our messaging? How do we describe what adult social care is, what living well, aging well looks like in Lincolnshire, and how do we describe that and show people that in a way that they understand it, not in a way that we as organisations want to portray it. So we have to kind of co-produce that element of access. We have to co-produce and talk to people who have struggled, like you've struggled, I've struggled, about, well, you know, how do we make this easier? How do we bridge these gaps between, you know, we have Connect to Support website, we have our LCC website, we have a new Lincolnshire website for health. We have lots of different places that we can go to, but they all seem very kind of siloed in terms of their approach. So how do we help people walk through that journey? It's a big piece of work that we're looking at. It starts with kind of understanding our communities, understanding our need, understanding where we can target that work. All of that work is going on with officers. And at some stage, we will bring parts of that work to this committee to say, this is what we've done, this is what we've tried to do, this is how we're addressing it, and this has actually been part of a co-production, and people with lived experience have kind of helped us do this. So I am giving you hopefully some assurance that pre-contact element and that pre-targeting of how people can understand what does social care mean, how can I get social care support. Councillor Woolley will be really pleased to hear this, because I know she was really keen about changing our websites for registrations and our ceremonies process. And if you look at the look and feel of that website on LCC and the current adult care website on LCC, they are distinctly different. We are moving towards the kind of the push button journey through, similar to a ceremonies booking. I know they're different to an adult social care journey. So what does an adult social care journey look like, and how can we describe that better with fewer words, better pictures, better direction of travel? So we're utilising some of the learning that I took out of running my registration ceremony servicing and working with our engagement teams and our comms teams and everything about how we then transform and change how even our LCC site looks, and how that makes it more welcoming, how it makes it clear for people. You know, so if I want carer support, I click the button that tells me that's carer support. You know, if I think I need an adult care assessment, I kind of click and we can start to kind of compartmentalize some of the needs, and it's all on our work plans. I'm very happy to bring back those outputs into committee, you know, to show you what we've done, why we've done it, and hopefully what the benefits and outputs of that are. So from a strategic point of view, that's what we're looking at. So really good observation, and one I share. I'll let Chris come with anything else if he needs to add anything.
Thank you, Martin. Councillor Young, thank you for your comments and the question, and I absolutely agree with what Martin and yourself have said around people, the ease of access for people to get in touch, whether that's about just getting some information that they need, or being able to have a conversation with somebody when they need to have that conversation. And I'm really reassured by the progress that's being made, and I know Martin and the team are really driving that work forward. Of course, there's a practice element to that as well, to ensure that our practitioners are accessible and we have our team set up in the correct ways. And I know there's also work underway to ensure teams are more connected with their local communities, so they understand and are accessible to people in the local community as well.
Thank you very much, Councillor Young. Thank you, Martin and Chris. And I think it'd be really beneficial to bring that to committee so we can have a look at it and see if anything the committee can add. Councillor Bean.
Thank you, Chair, and I'd also like to thank you for the report. Very enlightening. Just a couple of quick questions, really, based on your key actions on page 67. Your communication, you're talking about regular briefings to staff and elected members. What sort of timescale are we looking at, and how regular are you planning to have these briefings?
So the briefings to staff are now happening in multiple ways, Councillor Bean. We are on a weekly basis briefing teams about important changes. We're running practice forums on a quarterly basis where it's around practitioners, and then Martin Samuels and the assistant directors are also now have the sessions set up with both practitioners and people in other office functions up and running already. So in some ways we're further ahead than we'd hoped to be at this point and the time the report was written. However, as we move forward, one of the pieces of feedback from practitioners has been around being able to share sort of ideas and to be able to provide direct feedback. So I'm setting up quarterly drop-in sessions with our practitioners and teams as well to be able to do that.
I suppose the sort of question back from me is, I suppose the point was around the elected members bit. What do you expect to see and feel and hear? Well, you know, that's ultimately, you know, what is it you would like regularly from us, and how often do you think that might help? You know, is there a kind of a quarterly briefing sheet that kind of comes out through the exec council and member to you as members of this committee around the adult social care work that's above and beyond? You know, is that something that the members within this committee would find useful? So it's, again, you know, I don't want to dictate to you as members about what you think you might want. You know, I think there's got to be a kind of a two-way conversation through, you know, what does that look and feel like and how regular, that's outside of committee.
Thank you. Yeah, the second question really is, you talk about digital readiness and the performance dashboards. Who are those available to? Are they available to elected members or just officers?
They are currently available to the officers in the local authority. I'd have to defer to Martin. I'm not sure what performance reporting you get as councillors, I'm afraid.
And again, I think this is where we need to have that conversation around what is it, how is it. You know, obviously we can't. Some of those data dashboards hold private and personal information that we wouldn't be able to share some of those, but there'll be some that certainly we should be able to. And again, it comes down to that: how do we bring you into our adult social care world where you can look at, scrutinise, and understand some of these elements, and then how do we bring those back? Bearing in mind that Martin Samuels on a quarterly basis kind of brings the performance reporting to the committee. Do you want to, or feel as though you need more than what that looks like?
Right, you know, I was just really interested in the idea of a performance dashboard where we could dip in just to see how things are going, and I wonder if that was something you were looking at moving forward.
So I think it's certainly something we can pick up with the exec councillor and also Martin as the DAS in relation to that request.
Thank you.
Thank you very much. Councillor Overton.
Thank you. The data is actually, dashboard is on LG Inform, which is accessible to councillors and the public, but easily accessible. So LG Inform, and it compares there with other councils, so it's quite a handy dashboard. So the thing, there's a few small things on the report. I wouldn't start under the heading of key achievements with what's a PSW. You know, using acronyms is not so easy. Yeah, and I think also the report we get from the health, you know, for public health, is quite an interesting example, because it does come from the director, and it's the director's report, but it's quite a lot focused on the issues. So how many people are in this kind of need, and how well are we fulfilling that need, and what unmet need is there and what is the impact of that on the NHS, for example. So I think it's another way of approaching it, but it's nicely laid out, and that's fine. But I think everybody likes a few numbers or graphs or tables or something that kind of give you a picture of what the situation is, and I guess that's where the dashboard idea is coming from. So, you know, that I think that's quite nice. The question I wanted to look at is about the Section 75 workers. Do you have anything? I see in here that you have put that you wanted, or that you your example says that you then revise protocols and improve multi-agency collaboration, and that might be where this comes in. I don't know if you work with the Section 75 workers. Do they come under you? I know they're not employed by a county, because, yeah, and then I'll ask a few more questions about that.
Okay, thank you, Councillor Overton. So I do work extremely closely with colleagues at LPFT, and I'm principal social worker, cover the Section 75 social workers. So, for instance, we run communities of practice with them. We join up workforce development activity where possible, because currently under the Section 75 agreements, a lot of the learning and development is supported by LPFT. So there is that interface there, and we've been increasing that, and we've got some really good examples of the years where we've brought things together, like our Assess During Employment programme, where we support newly qualified social workers to work together.
Okay, so I could ask you some questions about that. Thank you. I have just put in a freedom of information questions about it as well, actually, so you'll probably get those along and I'll get them in advance. I was looking at the number of these workers who are specialists for people with mental health, because I think the numbers appear to have decreased over the past, say, 3 years, and which might mean that it's much more difficult for us to make sure that residents who need help are getting it quickly enough. I know this is a perennial problem that goes back many years. When I was on the Primary Care Trust, we got it right down to 12 weeks maximum, I think it was. So, you know, and then from 2 years for a child needing support. So, you know, it's been horrendous in the past, and I don't know exactly what it is now. But I'm a bit worried to see the number of those workers appear to be reducing, and also that the time taken, A, to be assessed, and then B, to get help if you need it. I wonder if you can comment on that. Thank you.
I can't kind of comment on what the current sort of service delays are, because obviously they are currently KPIs that sit within LPFT, because they deliver at the moment our Section 75 responsibilities for mental health services. What I can say is obviously that service is coming back into Lincolnshire County Council, and that Mental Health Care Act compliance work will fall back to Lincolnshire County Council, and we're just currently going through that process of transitioning back in, where I think the council will have greater opportunity to influence those things that you are talking about and take control of the things that you are talking about in line with the rest of our adult social care responsibilities, continuing to maintain connectivity with the sort of the acute trust in terms of managing crisis mental health services, and us managing the Care Act mental health requirements under the Care Act and the Mental Health Act. So I can't answer the specifics, but I can come back to you outside of this meeting, Councillor Overton, in relation to those two elements. But I think it's part of our transitioning into Lincolnshire County Council is about how we join up our adult social care services, and we seamlessly operate between mental health services, learning disability services, older people's, physical disabilities in a locality-based system, as opposed to mental health sitting over there and learning disability sitting over there, and older adult is actually about utilising it as an ecosystem so we can manage and support people closer to their communities at a time of need. So that's the future journey to do that, which hopefully will resolve some of the anxieties and the issues that you have, and we'll certainly have more transparency. But in terms of where LPFT are on their performance elements, I can come back to you on some of that.
Obviously, as we all know, contracting out the work does not contract out the responsibility, and therefore it's very important that we continue to know these things. We do get the KPIs, you know, we do get those, and I do remember raising it when it was here, when the KPIs were on the table. But I'm pleased that you recognise the issue, and it's certainly one we need to tackle, because it's expensive, I'm afraid. I'm sorry to say. When I was on the Primary Care Trust, we had a huge push towards reducing the hospital beds, you know, acute care, and putting people onto community care in the community. But you put the money in the community the first 2 years, 3 years, and then somebody looks for cuts, and there they are. So it is an ongoing battle, but it is so important, you know, to the lives of our residents, but who need it, but also their families and the whole community. Thank you.
Yeah, I didn't want to say organisationally we'll know the information that you know. It's just me personally sitting here. It's not the area of business that I kind of focus on. So yeah, apologies, I can't give you the answers to that now, but organisationally we certainly will have some grip and oversight of it.
Thank you very much for that. Is no more questions? Thank you. Thank you for your questions and comments. That now concludes the discussion on this item. I move that the committee endorses the annual Principal Social Worker report and is satisfied with assurance provided that the Principal Social Worker continues to provide strong professional leadership and effective oversight of the quality of social work practice within the adult care. Also, that we acknowledge the positive progression made in strengthening practice quality, workforce development, safeguarding arrangements and preparation for Quality Care Commission assurance. Also, that we recognise the ongoing challenges including workforce capacity and retention, increasing complexity of demand, and that the need for balance regulatory requirements with meaningful and sustained practice improvements. That the committee supports and the identified priorities for the year ahead as these are set out in the report. Finally, I ask that the committee and the comments and feedback from today's discussion be taken under consideration by the Principal Social Worker in support of his ongoing and future efforts. Can you please raise your hands if you agree?
Sorry. You often say, and the comments from the committee will be taken into account. That seems to have been missed this time. Can we add that?
Yeah, absolutely. I thought I covered it in there. I do apologise. Yes, so obviously the comments will be shared with the social worker as well. Yeah. Thank you very much. Can I have you raise your hands if you agree, please? Thank you very much. That's unanimous. Agenda item 7. Adult Care and Public Health Scrutiny Committee Work Programme. This item is on page 71-76 of the agenda pack. This item enables the committee to comment on the content of its work programme. The report will be presented by Chiara, Health Scrutiny Officer, who is now designated Scrutiny Officer supporting our committee. Chiara, thank you.
Thank you very much, Chairman. I know you're afraid, as everyone else, of my surname, so I'm just going to, for the purposes of capturing my details, my name is Chiara Hatioanu, and I'm the newly appointed designated Scrutiny Officer for this committee, and I am indeed the Health Scrutiny Officer for Lincolnshire County Council. So I'm not going to take a lot of your time. I just wish to remind all members that the work programme is a living organism, that agendas are being populated on an ongoing basis. Meeting by meeting, the work programme is being reviewed with elements that emerge at your debates and through your considerations of other items are also captured and inform future items to be planned. So I do urge all members to liaise with me today or offline at your convenience in relation to any items that you wish to see included in the work programme for this committee in future months. In terms of the work programme as that was published in the last iteration of this agenda, there have been a couple of changes that I would like to draw your attention to that are pertinent to our next meeting on the 3rd of June 2026. So firstly, as we heard Martin Parker confirming today, the CQC submission for the assessment of Lincolnshire County Council is anticipated at that to be moved to the next meeting on the 29th of July, with a potential for another type of engagement to be undertaken with members of the committee prior to that. Also, as you will have noticed, there is item 5 on that agenda, which is the Lincolnshire Safeguarding Adults Board annual report. And as you heard the chairman saying at his opening announcements, we will have a mini workshop following this meeting. So I would like to offer assurances and confirmation that a further report capturing the current year will be brought back to this committee for further scrutiny and comments. And the last point I wanted to raise is in relation to what Martin referred to earlier, the potential for a report on outputs, rationale and benefits of the planned website improvements for adult social care to be included in the work programme, and we will be exploring that when the time is right. Other than that, I'm happy to take any comments. Thank you very much.
Thank you very much for that, Chiara. Do we have any members wishing to make comment? No. Thank you very much. That now concludes the discussion on this item. I move that we approve the planned work programme for 26, subject to consideration of any item highlights being highlighted today, which there wasn't any. Can you please raise your hand if you agree? Thank you very much. That is agreed. That now concludes the business of this meeting. Thank you very much for everybody's attendance today. Thank you. Yeah, 5-minute break.